Subacromial shoulder pain is probably the most common diagnosis when it comes to the shoulder, and we generally get pain with overhead movement, and the pain is felt right underneath the acromion process. And so here are a couple of exercises that I typically use for the treatment of subacromial shoulder pain. First, we should start off by talking about the diagnosis of subacromial impingement syndrome, and really it's not a great name, and the reason is because it used to be thought that we have the acromion process here and the humerus here, and as we lift our arm up overhead, there'd be compression of the supraspinatus tendon as well as the subacromial bursa, and that would lead to pain with overhead activities. But there's actually debate on whether impingement is actually just normal biomechanics or it's pathologic, and we see this when we look at some of the research on osteophyte formation on that acromion process, where even if they remove that process, it actually doesn't perform better than a sham surgery or than just exercise. So the actual impingement or decreased space in that subacromial space might not be as important in this condition. One of the current thoughts about what causes subacromial shoulder pain is actually a supraspinatus tendon issue, in that we have the acromion process and the humerus, and in between is that supraspinatus tendon. And what happens is that tendon actually swells with activity, especially overhead activities, and then that swelling actually stays there, and it causes sensitization and irritation of that supraspinatus tendon. And so we actually need to focus more on the tendon that's in that area versus the actual structure around it, such as the acromion process or the humerus. For assessment of subacromial shoulder pain, there's generally two tests that we do, but they're not specific for subacromial shoulder pain. So if there's another cause of shoulder pain, it will likely give you a positive result for this. One of them is simply just lifting your arm up to the side and having pain somewhere in this vicinity. The second one is bringing your arm over your other shoulder and then lifting your elbow up into the air. And so what I like to do with these is actually do the test, do an exercise, and then retest. So either do the same painful arc test or bring your arm over your shoulder and do an elbow lift-off test to see if it actually helps change the pain that you're experiencing in the shoulder. Generally, when treating subacromial shoulder pain, there's two approaches that we can take. We can strengthen the rotator cuff muscles, which will help the centration between the glenohumeral joint as we lift that arm up overhead. And we can also look at strengthening the muscles around the shoulder blade, which will actually help move the shoulder blade up overhead with those activities. The first exercise that I like to do is an isometric hold for that supraspinatus tendon. And so what we'll do is we'll take an exercise band or a dumbbell, and we want to have our thumb up when we perform this exercise. And so generally we'll just lift our arm up to in line with our shoulder and just forward of actually just straight out to the side. That's actually in line with the shoulder blade, which is called SCAPTION. And so we want these to be fairly heavy, where it's actually stressing that supraspinatus tendon, but we don't want it so hard that we're actually shaking. And so generally we'll hold this for somewhere between 30 to 45 seconds. Once we're able to tolerate isometric holds on that shoulder, then we can actually just progress that same exercise to basically a lateral raise. And so what we'll do is we'll still want it to be fairly heavy. And what we want to do is focus not only on the concentric muscle contraction, which is actually lifting up, but also the eccentric contraction as well, which is actually lowering down. And so we want to do this over 3 to 4 seconds each direction. So as we lift up, it would be 1, 2, 3, 4, 1, 2, 3, 4. And that just increases the load that we're placing on that supraspinatus muscle and tendon. And even though the previous exercises focused on strengthening that supraspinatus muscle and tendon specifically, we can actually just work on strengthening the rotator cuff as a whole. And so what we can do for this is actually just take a mini loop and we'll place it around our wrist. And so for this exercise, we actually want to keep our forearms parallel to each other so we form an H and not let our arms go into an A pattern. And so typically we'll be up against a wall, but we can also just do a floating version as well. And so we'll typically stagger our stance. That will help isolate the low back from extending as we lift up. And so forearms parallel to each other, and then just slowly lift our arms up overhead, and then up off of the wall, and then slowly back down. And so there's actually an additional benefit to this exercise if it actually helps decrease the pain with overhead movements. And the reason is because that exercise band can actually just engage that rotator cuff muscle with overhead movements. And so we can actually just use this exercise to retrain a motor pattern of engaging that rotator cuff muscle if it decreases the pain with overhead movements. When we're looking at strengthening the muscles around the shoulder blade, there's three main muscles that help with upward rotation of that shoulder blade. And those are the upper traps, the lower traps, and the serratus anterior. And so the exercise that I like to help strengthen the serratus anterior muscle is a variation of the serratus punch. And so we'll take an exercise band and we'll wrap it around us. This side's going to serve as my anchor. This side is the one that I'm actually going to be working on strengthening. And so what I'll do is I'll push my arm out as far away from me as I can. That'll engage the serratus anterior muscles. And then what we're going to do is we're going to lift up overhead and then slowly back down. And so I actually use this a lot to see if it helps to decrease the pain with overhead movement, so that way we can see if it actually helps to change the motor pattern with overhead activities. And so if it does, we can actually just practice it just like this, or if we want to turn it to strictly a strengthening exercise, we can actually do some punches in some various ranges of motion to help strengthen that serratus anterior muscle. For the lower traps, I like to either use that wall walk exercise with the lift off of the wall at the top, or we could do a Y raise. And so we'll take an exercise band anchored in front of us. And so our thumb is going to point backwards, and what we're going to do is we're going to press back and then slowly back towards the anchor point. And we'll just repeat this motion. And so this is engaging that lower trap as we're going through. And so again, this exercise is good because if it actually helps to decrease the pain with overhead movements, we know that actually activating that lower trap helps to decrease the pain. And so we can actually use this to train that motor pattern to help decrease the pain with overhead movements. Even though the upper traps are commonly blamed for a lot of neck and shoulder conditions because it's too tight, I actually find that strengthening the upper traps can be beneficial, especially for subacromial shoulder pain. And the reason is because it's one of the muscles that helps with upward rotation of that shoulder blade. And so one of the exercises that we can do to strengthen the upper traps is simply a shoulder shrug. And so we can either take an exercise band or a backpack or a dumbbell. And so what we'll do with the exercise band is we'll actually just stand on it here, and then we'll slowly just lift our shoulders up towards our ears and then slowly back down. Again, typically going over that 3 to 4 second muscle contraction up and down. And so we don't want to just try to go and do as many as we can, as fast as we can. We actually want to be slow and controlled while we're actually doing this. Thank you for watching this video on subacromial shoulder pain. I hope these exercises were helpful for you. If they were, go ahead and give this video a big thumbs up. If you want to see more of my content, hit the subscribe button down below. And if you want to be notified of future videos, hit the bell icon as well. I'll see you guys in the next video.